In recent weeks, the number of new cases in the community has remained low. Among our linked community cases, about half were close contacts of confirmed cases and had already been quarantined. The rest were detected through our proactive screening or picked up from our enhanced testing of individuals with acute respiratory infection or ARI symptoms. The number of unlinked cases in the community is of greater concern, and it has also remained low. On the dormitories front, we are at the final stages of clearing the dormitories and testing the workers who have been isolated. The case count will likely remain quite volatile in the coming days before tapering down thereafter as we complete the clearance exercise. Elsewhere in the world, the pandemic continues to accelerate in many countries and regions. Some which managed to control an initial wave are now facing a resurgence of cases. In Asia, there have been worrying uptick in some areas, including Hong Kong, India, Japan, and Vietnam. Many Singaporeans are understandably concerned about imported cases. Indeed, we are keeping a very close watch. But keeping our borders sealed is not a sustainable strategy, as many countries have also come to realize. We have therefore taken a cautious approach to facilitate the return of Singaporeans, permanent residents, and work pass holders who are employed in Singapore, as well as long-term pass holders. To mitigate the risk of importation of cases, we impose stay-home notices on travellers upon their arrival in Singapore and test them before the end of their SHN. All of our recent imported cases so far have been isolated or placed on SHN. The risk of transmission to the community, therefore, continues to be very low. But we will continue to monitor the imported cases very closely, as well as the global situation, and adjust and update our border measures accordingly. As we gradually allow essential travel through the various schemes, we have reviewed our charging policy for COVID-19 treatment for travellers. Currently, the government bears the cost of inpatient medical bills for Singaporeans, PRs, and long-term pass holders who require treatment for COVID-19 at our public healthcare institutions, except those who breach our travel advisories. From 7 August, all outbound Singaporeans, PRs, and long-term pass holders who travel abroad under the permitted travel arrangement, such as that under the bilateral arrangements with Malaysia and China, will be able to tap on the regular healthcare financing arrangements for their inpatient medical bills should they have onset of symptoms within 14 days of their return to Singapore and require hospital admission for suspected COVID-19 infection. This means that Singaporeans and PRs will be eligible for government subsidies and MediShield Life integrated shield plan coverage, and long-term pass holders may tap on their prevailing financing arrangements, such as the foreign worker insurance, but any remaining co-payment will continue to be paid by the patient. Those who are not under the permitted travel arrangements and instead travel in breach of the travel advisories will continue to pay for their COVID-19 inpatient medical bills in full. In addition, short-term pass holders entering Singapore under the permitted travel arrangements will remain responsible for their medical bills should they test positive for COVID-19 within 14 days of arrival in Singapore. While our community numbers have remained low, we must continue to be vigilant. Many Singaporeans are anxious to resume some of the activities, but we must balance that with the risk of transmission. Learning from the experience of many countries that have seen a second wave or some even third wave after restrictions are lifted, the multi-ministry task force has adopted a cautious approach towards easing of restrictions. At the same time, we have heard from many Singaporeans about the activities that you hope to resume, and we understand why some of these activities are important. And that is why we recently eased restrictions on 2 significant life events, weddings and wake and funerals. We recognize that these are key milestones in life that Singaporeans hope to commemorate, and that memories of these events will stay precious long after COVID-19 pandemic is over. We will continue to assess the situation and allow the gradual resumption of other events, including wedding receptions and some religious rites. But on the whole, most other events should continue to remain virtual for now. These include large gatherings and festivities surrounding national and community occasions. This does not mean that we can no longer celebrate these occasions, but that we will need to find new ways to do so. Take this year's National Day celebration, for example. Singaporeans are a resourceful people, and many have found new and creative ways to commemorate our nation's independence while adhering to the safe management measures. With the right mindset and attitude, we can adapt and make the best of the situation, even if we need to continue with safe distancing measures. On this note, let me wish all Singaporeans a happy National Day and a healthy National Day as we commemorate our 55th year of independence this weekend. Thank you very much. And I'll ask my Director of Medical Services, Professor Kenneth Mark, to give a quick update on today's medical situation.
Thank you very much, Minister. As of the 6th of August 2020, the Ministry of Health has preliminarily confirmed an additional 301 cases of COVID-19 infection in Singapore. And the vast majority continue to be work permit holders residing in foreign worker dormitories. And based on our investigation so far, there are 4 cases in the community, of which 3 are Singaporeans or permanent residents. 1 is a work pass holder. In addition, there are 4 imported cases, all of whom were tested while being on a stay-home notice after their arrival in Singapore. From these 4 imported cases, there is no risk of spread to the community. We continue to aggressively test that final batch of dormitory residents, and as Minister has alluded to before, we continue to be on track to clear all the dormitories in time, less a few standalone blocks in dormitories that serve as quarantine facilities. Because the prevalence of COVID-19 infection in these dormitories varies, and we are testing various dorms over the next few days, the numbers that arise and will be reported in our press releases every day will vary from day to day. This volatility will continue for the next few days before it tapers down as we complete our dorm testing as part of the dorm clearance strategy. Overall, the number of new cases in the community has continued to decrease, as Minister has alluded to, from an average of 4 cases per day in the week before to an average of 2 per day in the past week. The number of unlinked cases in the community continues to decrease from an average of 2 cases per day in the week before to an average of 1 per day in the past week. We continue to monitor these numbers, but these numbers can only stay down with the cooperation of all of us in the community. And as we come into a stage where we are in a celebratory mood for the celebration of National Day, we ask all Singaporeans to maintain their discipline, wearing their masks, continuing with their safe distancing measures, and to do their bit to keep Singapore safe during this time when COVID-19 continues to be a concern. We are still working through the details of the cases that we've just reported today, and further updates will be shared via the MOH press release that will be issued later tonight.
Good evening. We had earlier shared that the task force was aiming to complete the clearance of workers in the dormitories by the first week of August. And I'm happy to report that the team has indeed been able to complete the testing of all workers in the dormitories and will do so by tomorrow, 7th of August. So what remains are the workers who are in isolation. Right? They have been cleared from the dormitories, but they are remaining in isolation in quarantine facilities. This final batch of workers who are in isolation will stay in isolation, complete their isolation period, and will be tested before they exit from their quarantine facilities. And that's why, as you've heard from the Director of Medical Services, you will still see volatile case numbers over the coming days, perhaps over the next 2 weeks, because as these workers complete their isolation and we subject them to a test, we don't know how many will be testing positive or negative, right? It may be that very high numbers test negative and then we will have very few case counts. But it may also be that quite a large number test positive and then on occasion you may see spikes in the cases. But we expect that to continue only for the next 2 weeks because we are dealing with the final batch of workers who are in isolation. Thereafter, we do expect the number of cases to taper down significantly because we would have cleared all the workers by then. The other issue that we are dealing with is to try and expedite the process for these cleared or recovered workers to get back to work as soon as possible. And we've shared before that we are working with all the contractors and employers, engaging them very closely to start preparing now. Do not wait for the workers to be cleared. Start preparing now so that they can meet all the safe distancing, safe management measures and can resume work as soon as possible. So that work is in process. We are continuing this engagement efforts with all the employers, especially for the construction contractors, and we are confident with this expedited processes that the vast majority of workers who are cleared or recovered will be able to resume work by the end of this month. So we are not only clearing the workers in the dormitories and making sure that they are safe, but we want them to get back to work as soon as possible, and we do expect the vast majority to be able to do so by the end of this month, which means that many construction activities and many construction projects should be able to resume soon. Finally, I should add that just because we have COVID-cleared dormitories doesn't mean that we should assume these are permanently COVID-safe dormitories, because we all know that the virus can flare up again, and that's why we are putting in place safeguards, particularly to ensure that all the workers in the dormitories will still be taking routine and regular tests once every 14 days. So that process and that regime, on top of all the safe management practices that are in place, will continue. And we will ensure and do our very best to working with the employers and the contractors to make sure that construction activities, that all of these activities that are of a higher risk nature will be done in a safer manner going forward in order to minimize the chances of large clusters forming in this sector again. So we will do all we can to put in place these additional precautions. At the same time, for all of us in the community, we again must not be complacent. By about the second half of August, as I said, with the dorm cases tailing off, we should see the total number of cases in Singapore coming down. Not just the cases in the community, but the total number of new cases every day should come down significantly by end August. But that is not reason. That is not a reason for us to be complacent or to let our guard down. We have seen the experiences everywhere in the world where even if there is a very low level of underlying transmission, very low level, cryptic, silent transmission happening, and so long as there is a lapse in the community or people do not observe the safe management practices carefully, these low levels of infection can suddenly flare up into large clusters anywhere, anytime. So we all just need to be mindful of this risk which still remains, and we all have to do our part to be socially responsible and do everything we can to comply with the safe distancing measures that are in place. So we encourage everyone to stay vigilant. We know it's not easy because it has been a long fight. For the past 7 months, we have been dealing with this virus, but we are making good progress. We are able to keep our community infection rates low, and we can, if we maintain that attitude, that mindset and discipline, we can continue to reopen and resume more activities in a safe manner. And on that note, let me join my colleague Mr. Gan in wishing all Singaporeans a very happy National Day in advance. Thank you.